Dear Elpa friends, far too long people living with obesity have faced stigma, blame, and barriers to support. Today, on the World Obesity Day, we have to remember and remind the society that obesity is not due to the lack of willpower. It's not a personal failure. Obesity is a disease, and nowadays it's one of the most significant public challenges affecting 800 million people worldwide. Nowadays, our society is filled with cheap and available high energy density food dominates. However, the opportunities to be physically active are reduced. This environment causes people to gain excess weight, and children are not exempt from it. Childhood obesity is expected to increase by 60% over the next decade, reaching 250 million children by 2030. Society needs to recognize obesity as a disease. This will help reduce weight bias and stigma, encouraging people to seek medical care and preventing the development of other conditions. Shifting the public discourse away from individual blame could help ensure access to treatment for everyone in need. Recognizing obesity as a disease can also foster investments in obesity research and improve the education of health professionals to prevent and to manage obesity. The factor is the key word when talking about obesity for two reasons. Obesity is a disease caused by various factors, and at the same time, obesity is a risk factor. People living with obesity are more likely to suffer from chronic diseases such as, for example, non-alcoholic fatty liver disease, or NAFLD in short. This disease can cause the liver to swell and to develop cirrhosis, which can lead to liver cancer or liver failure. Since NAFLD is a silent disease, this means that often there are no symptoms. High importance must be given to the screening and prevention of the population at risk. Our window of opportunity to ensure better, more resilient, and sustainable action on obesity is now. Everybody needs to act. Together, we are stronger.